Well, good evening. This is Dr. Ellithorpe, and we're here at Tustin Longevity Center. Today's date is February 25th, and this is Tuesday night, 6 o'clock, where we meet. We do a Ask the Doctor Anything. I'm a functional doctor, general practice, and have been doing so for 44 plus years. We are several healthcare providers here at Tustin Longevity Center. And what we try and do is to try and create a forum for you to try and ask a question about a topic of health or concern. You can do that through the email. If you get onto our tlcdoctors.com, you can get on our email and type in the question you have there. We'll send you a link and notify you about that. The other way is you can get on the YouTube if you're on YouTube and type in your question live. So when I see these questions pop up, I will go to them first for those who are taking the time to be with us live. And so we are not doing this to replace your doctor. We're just doing this for educational purposes and trying to give you an idea about how a functional doctor, integrative doctor over 44 years would look at things on a general basis to any question that you might have. And usually that provides lots of questions. And so if you are benefiting from this, please like and subscribe. Hit the like button so that we can share this with more people. And we'll begin today with the email questions. And the first one I have is from George. George says, "Hi, Dr. E. Working on lowering my PSA, prostate specific antigen. Have a sensitivity to eggs. Discovered I get inflammation when I consume too many omega-6 foods, even healthy food, i.e., Brazilian walnuts and pecans. I am reacting to the fat of the egg yolks." Or the question is, am I reacting to the fat of the egg yolks? Or is an organic pasteurized egg the same as a commercial uh, organic egg for inflammation? Should I buy from farms? All right, so in general, George, the whole issue about omega-6 fatty acids, they're essential. You have to have omega-6 fatty acids, and they go into your cell membrane, and they have two double bonds. The omega-3 is the alpha linoleic acid. It has three double bonds. The uh, omega-6 has two double bonds. And so what we have to do and understand is when God made the fatty acids to make up our bilipid cell membranes, he put these charged membranes that have a missing hydrogen on it, and it makes it a little unstable, and so they make double bonds, and they become electrically, you might say, attractive to other donators for hydrogen. So if you have a protein molecule that's going to get embedded into that membrane, the protein molecule will have on its surface lots of extra sulfhydryl groups with hydrogen on them. And so the fatty acids will kind of put their hands around these proteins to hold them in the membrane that is a membrane that is fluid. So you have the membrane, you have the protein on its side, the surfaces has sulfhydryl groups, extra hydrogens. And these fatty acids, these chains that are kind of hanging down and up, they have double bonds that are reactive. And these double bonds are attracted to the sulfhydryl on the proteins. And it's a big happy family. It's like a man loving a woman and taking care of the membrane. So fatty acids such as linoleic acid, which is the omega-6, is essential, and you become sick without it. What has happened in industry, and the big lie that you have been told, is that omega-6s are bad, but they're not bad. What is bad about omega-6 is when You have people like my father who worked for Armor Food Research on the TV dinners. They realized that these oils combine with oxygen and they become rancid or rot. And with this rotting has a smell, and people will not buy rotten old food. So how can you sell a TV dinner food that was prepared a month ago and has what they call the freezer burn? So they learned to hydrogenate all those fats so that they will not combine with other things. And it's okay for a dead piece of meat, but it's not okay for a living cell membrane like yours and mine that has to be interactive with the fluid that is surrounding it, the structured water, and be responsive to the inside and the outside of the cell functions guided by the various modalities that touch the receptors and communications that are going on. So omega-6 is wonderful. Linoleic acid omega-6 is wonderful. It is hydrogenated omega-6s that are in all the processed foods, all the potato chips, all the TV dinners, all your uh, frozen foods, and they are what are getting falsely inside of these membranes, these bilipid membranes that make up your cells. Okay, and then they don't react properly with their environment and you get sick, you get injured from this. So are you really sensitive to eggs, or do you have an injured lining from your mouth down to your anus of that one cell membrane thick gastrointestinal lining that has the immediate impact of you eating all these hydrogenated fats, hydrogenated linoleic acid omega-6s, and then you can't process them out, and you eat a lot and they build up in your membranes and they're inert, they're like damaged goods. So I would say that the answer to your PSA lowering is multifaceted. It's not just doing a food sensitivity. It's looking at many things in your body, your insulin resistance, the level of hydration that you have, how much water you're drinking, how much exercise you're doing, how good is your sleep, how good is your microcirculation? Would you benefit from a high dose vitamin C immune boosting drip with EDTA chelation therapy to open up microcirculation, improve nitric oxide synthetase production and nitric oxide, which will help blood flow, help erections, help your blood flow from your head to your toe? Where would I get the healthy eggs? I would get them from pasture raised farms or small farms. You have to get the word pasture raised. Um, Free range doesn't cut it. They deceive you. So much of marketing is a lie wrapped in another lie. So that's where I would go for that. And get a good, try and work with your primary care, your functional doctor, and work on all these things to do that. We're getting in some live questions. Let me go ahead with the first one that says, hi, Dr. Rita. Any thoughts on getting a cat or dog? My husband and I are mildly allergic to cats, but our daughter is dying to get a cat. Any health benefits or dangers if we're already allergic? I would tend to go with a dog, and the reason is cats really become very intimate pets, and they hop up onto counters and places that your dog is never going to invade. I don't want to be against cat people, but there is toxoplasmosis. There are certain parasites that come along with cats, and I just really prefer not getting that because that can get into the nervous system and create problems. Of course, it isn't common; otherwise, people would be aware of this much more and have much more history of it. But in general, I would go for a dog now. Um, I have very mild sensitivities to dog dander and cat dander. So if I pet a cat or a dog, I can get little tiny red spots on my skin. And this is like a tiny micro hive. I learned that if I take quercetin in the TLC seasonal shield, which is really dehisced by orthomolecular, it has 200 milligrams of quercetin in it, and that acts as a natural antihistamine. It acts as many other things. It works to stabilize mast cells and has some anti-cancer benefits in the cell mitochondrial metabolism, energy management issues. It's very interesting to see some of the anti-cancer benefits. It also acts as a antiviral. So there's many wonderful things about quercetin. So if you're going to get a cat or a dog, you might want to always take the natural herb quercetin and probably aim for, I would say, 400 milligrams to 600 milligrams a day. Plus, you'll get the benefit of less viruses and colds, and you'll get less allergies in general. Christina says, "Hi, Dr. Rita. My husband is having chills, body ache, fatigue, no fever. What do you recommend he can do at home?" Well, the old adage, starve a cold, feed a fever. So, I would encourage anyone who's getting ill to fast. Just stop eating. Food is a tremendous immune demanding function in your human body. And the minute you drop something down your throat, your whole system is alerted to make almost a third of your blood flow start circulating your gastrointestinal system much more, to have more of the white blood cells circulating and doing surveillance for any bad thing that might have been in the food. So if you're starting to get ill, fast. Just don't eat for 24 hours. If you are hungry, you'll drink more water. You will maybe put vitamin C in the water, like Emergen-C or Vitality C, and electrolytes for minerals and salts. And that will be very helpful for the circulation for your immune system. The lowering of the blood sugar from fasting also is another wonderful boost to the immune system. The lowering of the sugar also helps the phagocytosis of your white blood cells to identify and surround and capture viruses. If you take increased vitamin D, we have 50,000 international unit capsules. And we normally say take one a day for 5 to 7 days. So you get an immediate boost in the T cell stimulation function of your immune system from vitamin D. Taking extra zinc in the form of a wonderful multi-mineral supplement like TLC multi-mineral. There's 25 milligrams, for instance, of zinc in that multi-mineral from TLC. That will also boost your immune system because zinc is so important in preventing viral replication from the ribosomes in your cells. So those are some of the things that I would do. Of course, if he isn't better with doing that in a couple of days, have him see his doctor. If he gets a very, very high fever, something above 103 or 4, and I would try to avoid using any Tylenol or aspirin. And the reason is God gave us a fever to stimulate interferons, which are another type of our immune defense system. If you're shutting it down for moderate fevers, you're shutting down part of your immune defense. So you have to use wisdom in deciding whether or not you're going to treat a fever with Tylenol or aspirin. The other thing is, I would certainly encourage you to rest, and maybe take some systemic enzymes for that achy feeling, that myalgia, low backache. On the empty stomach, you could take 5 or 8 systemic enzymes, and that will work to be an anti-inflammatory, which will help allow you to avoid pain and so forth. So that's what I would do. Dennis says, is autism neurodegenerative? It is a term for a behavior that is associated with less function of the neural system, so that you can tell the behavior of a person is affected so that they can't function appropriately. So it's a term, an umbrella term, autism, for a neurodegenerative change, so you can't function appropriately neurologically. And according to my family doctor, it is, and that's true, it is. Now, the question is, what's causing it? What is causing it? And then, of course, we believe that there are many factors contributing to this, and looking at the whole story of the development and the lack of safety studies, maybe with the childhood vaccine program. If you would read Dissolving Illusions, that's Dissolving Illusions by Dr. Suzanne Humphreys. And that'll open your eyes up tremendously. You could also read JFK Jr.'s book on the issues pertaining particularly to this past pandemic thing they claimed happened to us in 2020 to present. And the book title is The Real Dr. Anthony Fauci by Robert F.K. Jr. So I would read those 2 books. There's many other documentations on this. You could read about Dr. William Thompson's whistleblower report of the 2002 pediatric publication on the safety of the MMR vaccine, and they actually suppressed any negative data and they deleted it, and it was associated with increased side effects from that immunization of that MMR to especially Black children, especially Black boys. And there was some implication of testosterone involvement, but there's a whole William Thompson cover-up of the MMR vaccine publication that was put out in Pediatrics in 2002, or it was 2004. But anyway, whoever the head of the CDC was, it was a female CDC, she allowed this cover-up to occur, or conveniently claims she didn't know it, or let it slide under her nose. And what do you know? She gets put on the board of a pharmaceutical company. That's what I would call hush money, or that's what I would call a book deal given to someone, even though the book doesn't sell, you get paid off. That's the way I look at it anyway. I think it's a likely probability, but you have to read it, come to your own decisions on that, and then talk about it with your doctor. Let's see. The next question is, Christina said, tonight while making dinner, I felt a weird sensation in the back of my head, leaned to the right for a second, then my heart started racing. I think a possible anxiety attack. Any natural remedies? Christina, I would say I don't know your age. I don't know anything else about you. If you're concerned about this, I would go to an urgent care and see, or call your primary care doctor, because that is just too potentially concerning, like racing heartbeats, your brain. I don't know whether you had what they called a vaccine for the mRNA for COVID. That's associated with side effects that are associated with some issues of heart rate dysrhythmias and uh, brain bleeds, things like this. So there are many things that it could be. So the venue for addressing that, if you're concerned and having these symptoms, is to be seen by an urgent care. But we can. I remember when I was in medical school back in the early 70s, mid 70s, and we were studying these things in pathology. I mean, the whole disease milieu, hours and hours and video or slides of all these diseases, especially in dermatology. And I'm telling you, I was so enthralled. I was uh, starting to itch my arm on dermatology, and I had a sweater on that went all the way up, let's say to my wrist, and I went under the sweater and I busted it apart, the seam. I was so worried or subliminally thinking about all these disease things. So to some degree, I think the YouTube can be abused. You can work yourself up with limited knowledge, and there can be very simple explanations, minor pains, minor heart palpitations. And the more you read about things like this and now see YouTubes or other people with their testimonials, it becomes a dark Pandora's box that you can open and just drive yourself into a state of fear from it, and then unnecessary visits to your doctor. So please be cautious when you are thinking about addressing symptoms or being on YouTube. Again, this is not medical management. This is just telling you how a doctor of many 44 years practice thinks and what some ideas might go along with that. The next one is from Debbie. Debbie says, "Hello, Dr. Rita. I have completed 40 chelation treatments and now on maintenance of once a month. Would detoxamine suppositories twice a week be a good add-on? Thank you." Many things to think about here. Detoxamine is something I was associated with that name of that company back in the early 2000s, 2004, 3, 4, 5, 6, because I wanted to try and find a way to deliver an effective chelating mechanism through the absorption that you get through the transrectal delivery of medications, because we give that to infants, like a Tylenol suppository if they have a fever. We give anti-nausea medicines as suppositories, like Compazine is a suppository up the butt, especially like if you're pregnant and vomiting all the time. So it's a good medicine delivery area, at least relatively speaking. An oral or IM or intravenous is extremely much more superior, but the rectal delivery may be 18% of what an oral dose could do, and maybe 5% of what a intramuscular, or certainly the intravenous. Nothing can compare with intravenous because that's the most great delivery system. But the company started making it available to people online, maybe greed, I don't know. I always prescribed it to one patient at a time under my supervision. And I later learned that people were getting this on the internet. Well, then eventually this was found out and shut down. So in the United States, it was not, you were not able to get detoxamine. So I think it went overseas. And I think there are black markets where you can get a hold of this. But my question then is, I am no longer in contact. I don't know the makers. I don't know the safe production sites generally. Considered safe manufacturing methodologies, and what it's made with. So I can't speak to its value and safety. Therefore, it's a mess because I did so much research on the product we used and created, and it was so superior and excellent and so helpful. So there you go, corruption and greed of the human heart, and selling it out where it shouldn't be sold because it is a drug under the doctor to be prescribed. And now nobody can have it. It's like in the classroom. I remember even in first grade, uh, doing the work there in first grade, and some child would act up or cry or scream, and the whole class would get disciplined. And I remember that all through my life. It's so sad. Everyone gets punished for the actions of a few. Eventually, hopefully, we can find a way to solve that. Certainly, with my worldview of Christianity, my hope is in Christ and life eternal through Him and us getting along well then. But yeah, detoxamine is not something I'm going to endorse or recommend. Uh, and even when I do prescribe chelation through a pharmacy as a suppository, it is not the quality delivery system that we had developed in the original formulation. So there you have it. So I'm not going to recommend it. Uh, Pacific Health Sciences says, hi, I'm getting a PFA ablation procedure next Tuesday. Paroxysmal what? Uh, patent ductus. I don't know what PFA stands for. Fibrillation, patent ductus arteriosus. But anyway, she goes on to say, and of course, I'm nervous about it and wondered if you had any experience with it. I have persistent AFib. Oh, okay. Paroxysmal atrial fibrillation. Okay. So that's what it is. And I have tried cardioversion and um, other things that apparently have not really worked for you. My experience is that over the many decades that I've been around people with atrial fibrillation, some chronic, some paroxysmal, it comes and goes. And when the ablation didn't work, uh, they use these other procedures, and I've never seen a bad outcome. I am just happy to report to you in general practice that indeed the management of AFib today and the cardiovascular sciences seem to be doing a very good job. So I want to say my understanding is that you should do very well with that. Okay. Leah says, can I take a digestive enzyme after drinking coffee? Well, it's meant for digesting food. So if you have eaten food products, real food, and you're having coffee, yes, you can take it. Yes. Barbara Cornish says, I have a friend who had COVID for the first time in June of this year, or at least what they claim is COVID. Um, I have never seen any viral cultures done for viruses. This is all PCR testing now, polymerase chain reaction testing, which is not the way Dr. Carey had, who discovered polymerase chain reaction, had intended. He said it should never be used for diagnosis. So now they can use the mystery of science and cycles of polymerase chain reactions to amplify finding one molecule, and they can create these types of antigen antibody tests that are not reliable as far as conformational antigen positive for COVID. So there's so much fraud in our medical system. I'm not sure that you really had COVID. But either way, let's finish the question. Um, After that, she was experiencing enlarged lymph nodes. Okay, does this have something to do with long COVID? She is vaccinated. Well, it would be suggested that her immune system, having had the vaccination and then being exposed to a viral syndrome, that there may be some molecular mimicry. It looks like a duck, it walks like a duck, so maybe it is a duck, and the immune system hyper responds to this and makes these uh, spike proteins. And remember, the um, messenger RNA was a gene management device through injection to put that into your cell DNA replication or mRNA replication ribosomes to produce on your own in your own body the spike protein. And so, if there's some gene or molecular mimicry, then you are going to trigger maybe this memory and produce all the spike protein, which will inflame your body and make your nose enlarged. So have her see a good functional doctor or her doctor and try and get some high dose vitamin C and vitamin D and systemic enzymes and help work with her to see if she can't be improved. But that should be followed up. And then the next question is, great is thy faithfulness. I've heard you recommend the complete digestive stool analysis, but my naturopath doctor wanted a GI map stool analysis. Will it give me the same information, or should I ask for the one you recommended? You have to work with the healthcare provider you are working with. The uh, GI map stool analysis is using a lot of that polymerase chain reaction study sequencing. And if your healthcare provider is more familiar with that test and its results and outcome and has developed management skills and guidance with it, it might work better for you to follow just along with his advice. We are all limited, and this is not a standardized teaching. And so I am familiar with the vast majority over these 44 years of practicing, and many doctors are now rushing, many nurse practitioners and physician assistants are all rushing now to what has finally been popularized, which is functional medicine. Even allopathic standard trained physicians are rushing into this. And they are rushing into selling nutrients or designer nutrients and coming up with their own private labels. And everyone is rushing into it really to help the patient or to make money and fame. I don't know. I just see a lot of stuff that I think is marketing and for making money. But maybe it's just their lack of experience. There's no real cohesive training or standardization. And there needs to be some latitude so that we never become so strict that the allopathic physicians have a stranglehold on caring physicians again. There needs to be a fluidity and a camaraderie and an understanding of the capabilities of all the disciplines, so that a patient will get the best benefit from each discipline. Allopaths traditionally control all healthcare, set all the rules, have all the boards, and poor chiropractors and other therapists have been beaten down and called quacks. And now those same allopathic physicians are putting their tail between their legs and they're crawling back and secretly learning and going to conferences on functional medicine. So I don't know that I'm going to give you a direction, yay or nay. I'm going to tell you both are valuable, but they're meaningless if you don't personally take the advice and apply it to your personal life. And so that's the beauty of what is called clinical medicine, having a healthcare provider that you feel you may not care about how much they know per se of everything, but you really do care that they care about and know you. And here's where the big disconnect is. We've got all these degrees and fancy specialties, and in fact, we parlay them and parade them around. We puff them up before everyone. But in fact, what people want is a doctor that will stay put, be there, year after year, decade after decade. You get to know them, they get to know you, and you understand their capabilities and their limitations. And when the doctor is presented but with something that they're unfamiliar or they don't feel capable enough in, they will call upon the more rare specialists, and the specialists will be more humbled because they could never take care of the wide swath that regular knowing, loving doctor does. So do you see the difference? Everyone's talking now about JFK and we have to fix healthcare. And I just told you what the problem is. The problem is they don't care. They care about the money and they care about the fame or, you know, limited hours or a minor one area of your body. And the people know that they don't care. So real doctors are doctors who care. They stay in one place. They learn a population of people, and the people learn about that healthcare provider. That is what makes a good doctor. Now, of course, if that doctor can continue in their general education and they can go to conferences and continuing medical education updates, learn about functional medicine, learn about all these other wonderful things, and expand their knowledge base, work with some of their specialists, grow in knowledge and experience. But ultimately, what needs to happen is people have to care. Both the patient care enough to want to improve themselves and take responsibility, and the doctor has to be there to be single-minded in saying, yes, this is what you must do. And it's not that I care. I would love you to love me, but I'll even say what you need to do if that upsets you. You know, a lot of people hate it when I say you have to do weightlifting or you have to reduce your sugars and carbs. I've been doing that for decades and decades. But now it's become a fad and all these carnivore talks and carnivore recipes. And there have been some patients that, you know, just were upset and think that all I care about is their blood sugar, because your blood sugar is one of the most determining factors of your long-term health and the resulting insulin and triglycerides and hemoglobin A1C. So you can get angry with me, but the message has to be true. And this is what we need. So what tests to do? You'll get a sense with your healthcare provider if that GI mapping he feels or she feels very strongly about, and they are leading you confidently in a healing pathway and it makes sense to you. I think that's reasonable. I wouldn't insist on the complete digestive stool analysis necessarily. Greatest Faithfulness says, what lab test should I ask my doctor for to make sure a family member doesn't have fatty liver? One of the big giveaways is doing a abdominal ultrasound. If you just do that nice ultrasound over the liver, you can actually see the structure of the liver showing infiltration of fat. One of the lab tests that are very significant for that is the liver enzyme ALT. ALT. So if that's elevated, that's early signs, most typically, of fatty liver disease. Now, there are many other things, but all being said, the high carbohydrate, high fructose corn syrup is just destroying the American health system, and it's just destroying all the industries, the military, the hospital food, the school programs, the nursing homes, all these institutionalized programs that have government and state following the edict of some central food and drug and dietary recommendations under a central control have been bought off by food producers that produce cheap junk food that they fill with high fructose corn syrup. And the lobbyists visit your congressman and senator, and they buy their votes. And so we have to get rid of this, get it out and get it decentralized, get healthcare involved in your local doctor with his local office, and stop this foolishness of all this mega centers and, you know, programs that are hospital based. Of course, they want you to get sick. They want you to use the hospital and fill up the beds to make their money. No, it's all flip flop, upside down, and wrong. The next live question is Robert. Dr. Rita, I have been ill since February 5th. Sinus infection, tightness in my lungs, and an ear infection. What should I take other than prescription ear drops, prednisone, azithromycin, albuterol, and Flonase? Well, it sounds like you're under the care of your local doctor, and you should follow their advice and follow up with them, especially if you're not improving. But again, what I would say to do is consider a high dose vitamin C drip. Consider fasting for a day or two, eating nothing, going on a water fast, and taking enzymes systemically. That's God's natural Pac-Man to chew up old injured cells that aren't revivable and get them cleared out of your system so new healthier tissue and cell membranes can occur. Make sure your vitamin D is high. I would use for a week, 150,000 international vitamin D a day for a week for anyone who has a smoldering kind of cold and symptoms. I would use the zinc TLC multimineral 3 a day. I would use Argentin nasal spray. This is the the nano solution of silver, 23 parts per billion, which is very effective as an antiviral, antifungal, antibacterial. You can squirt that up your nose, dozens of times a day to rinse and put this nice antiviral, antibacterial, antifungal solution there. You can't overdose with it. You could take a bottle of it, swish, gargle, and swallow, and do that. So fasting helps. Vitamin D, 50,000, one a day for 7 days. Taking the zinc and the TLC multimineral, the Argentin nasal spray, the systemic enzymes to disinflame you. You could take the antiviral quercetin that is called Seasonal Shield. I would use 2 twice a day or 800 milligram. Each capsule is 200. These are starting points of how I would approach a patient who's already seen their doctor, put on medicines, nasal steroids, and antibiotics, and they're still not quite recovering well. I would do all these things with a high dose vitamin C, maybe a couple, one day after another, 2 or 3 of them. Cynthia says, hello, I've had a strong intestinal reaction to Candicid Forte capsule. Should I stop taking them? Candida was diagnosed through the stool test. It is powerful. Those oils that Candida has in it, very powerful herbal and oils that, I think it's 3 times a day. I rarely prescribe it. So yes, you can stop it, but you should go on a fast for 24 hours, 48 hours, and then do intermittent fasting thereafter, and try and eat in a 6-hour window. Exercise, eat low carb, and you could take something like TLC metabolic formula that has the berberine and the alpha lipoic acid in it. These work to help you lower and metabolize your sugars, especially if you don't put more in you and you're burning them up with exercise. Then your candida will go away on its own in general. And that works for the vast majority of my patients. And that's how I would approach it. So yeah, you could stop it or greatly lower the dosing to 1 a day or 1 every 2 or 3 days to stop that. But discuss it with your doctor. These are generalized statements, and send them an email message or rather a call here to the office if you're seeing our doctors so that they can talk with you about this. Let's see. The next thing is Roberta says, I never had a fever. Thank you. Okay, good, Roberta. I'm glad that worked out for you. Annetta says, Glycine was suggested as a way to prevent insomnia, intermittent fasting. It's taken with magnesium threonate. When I couldn't find glycine, magnesium glycinate is suggested. Is this close enough to glycine with magnesium threonate? No, it's not exactly the same thing. So I'm going to say, Annetta, that if you call the vitamin shop or call the healthcare, if IF, I see IF meant if. Okay, so the way to prevent insomnia if it is taken with magnesium threonate. So no, they're not equivalent. And the idea, whoever is helping you, your healthcare provider, I like the magnesium and the threonate, and I like the magnesium in that form. So that would be the direction I would try and find it, order it on the internet. Let's go to some of these others on the paper here. Vicky said, hello, I was wondering your opinion on wearing polyester or synthetic fibers. Lululemon or Athleta, these are types of athletic wear when exercising. Is it worse to wear in heated environments such as hot yoga? Should we go back to cotton, and should cotton be organic? Thank you. The answer is yes, 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 and yes. These petrochemical oil-based synthetics are not your friend, and your skin is one of your largest organs that absorbs toxins right through your skin. So I don't like these polyesters, and I don't like them being worn, especially for exercise and in the heat that it is generated in. Yes, I would work with cotton or linen. L asks the question, what do you recommend for the treatment of melancholy? 100% I recommend exercise. If you really look at a retrospective meta-analysis of any quality antidepressant, sad affect study, and they compare it to just having them do weightlifting and brisk walking, getting out in the sunshine, there is hands down nothing as powerful and guaranteed to help as exercise. Ronnie says, my ears have been plugged for 2 weeks. I am drinking lots of water and doing either a rebounder or vibration plate daily to keep the lymph moving. Any other suggestions? High dose vitamin C and systemic enzymes, that would be the other thing, and taking maybe some quercetin, a natural antihistamine. Christine says the viruses going around seem to be lasting forever, even in the young and healthy persons. I'm immune compromised and have been ill with a virus since mid-December. I can't seem to kick it. Antibiotics are not an option. Christine, high dose vitamin C, a series of doing them a couple times a week, should help get you over that. And things like the quercetin, you might try the ivermectin prescription, but I would see your doctor so you can be evaluated. Mid-December to now is 3 months, and you need to have that addressed. So enzymes, lots of water, low carb, intermittent fasting, and the enzymes with the quercetin, high dose vitamin C IVs, that's the direction I would go. But see your doctor and let them help you work this through. Try and find a good functional doctor that'll work with you on that. Colleen says, my daughter just learned she's pregnant. She is on Lexapro. Should she continue or try a supplement? And if so, what do you recommend? Thank you. First of all, I would have her talk with her OBGYN. She needs to see her OBGYN as soon as she can in her pregnancy and tell her that she's on this serotonin reuptake inhibitor and what other recommendations she has. Now, I've seen many women on that, and they deliver very healthy, wonderful babies. But this is something she needs to address with her OB doctor. I would strongly encourage her to get vitamin D. Vitamin D is a natural antidepressant. I would strongly encourage her to be low carb and not eat late at night so she gets a good night's sleep. I would strongly encourage exercise and adequate hydration and eating a rich protein with healthy fat, real food in her diet, because now she has to make the phospholipid membrane, protein, and fat membrane to create a baby. So she needs to be doing all that. But take this to her OB doctor and address it. Lee says, is there an optimal range of estrogen and progesterone that perimenopausal women should be on to get rid of perimenopausal symptoms like night sweats, etc., yet also help with other bodily functions? Also, do you recommend to cycle the hormones or take it constantly every day? Lee, this is why we have to have doctors that you can come and see over and over again, and they work with you, because the hardest time to help a woman is really during her perimenopausal change, because sometimes she'll be healthier, feeling better, and she'll make more hormones. Maybe she'll even ovulate, and then another few weeks, the hormones will drop, or she didn't ovulate, and she'll feel estrogen dominant symptoms. So working with your doctor is something that you have to do, and the doctor has to decide at what point are you not going to follow a failing signal for hormone production and take it over and run it. It's like a dance. You have to decide who's going to lead in the dance. So I tell perimenopausal women very often, this is a hard time for both doctor and patient. It means there will be more visits and more lab testing, because not all women are equal and there's no number for a woman. I have some women who are very satisfied and get rid of all their symptoms of hot flashes, night sweats, insomnia, and they feel good memory and zest. And their hormone level, when I test it, and they're consistently taking the estradiol, that estradiol may be just 50 or 80. And for them, that's good enough. Another woman with the same time of cycle, the same time of age and perimenopause, she might need to be 150 before she gets relief. So you see, we're all different. The progesterone, some women like it continuous because it really helps them sleep. I tend to like it, and I personally use it on a 2-week on, 2-week off cycle. So half the month, the 1st through the 15th, I just am on my estradiol and progesterone. But the last 2 weeks, I stay on my estradiol, but I'm off my progesterone. So that if I'm going to menstruate in my 70s and have a monthly light cycle, it'll always come at the end of my progesterone usage, because progesterone begins to mature the lining of the uterus and clean it out as the progesterone drops off. So either way rather is a okay thing to do, as long as you and your doctor are talking about why and how they're going to follow you. So you discuss that with your doctor, and you try different hormone support. Sounds like you need more estradiol. You definitely should be balanced with progesterone, even if you don't have a uterus. I disagree with doctors who don't give both, because women were made to have both in interaction and control. She says, I'm 48, and she takes the 0.075 estradiol patch twice a week, and she's using the 200 milligram of progesterone for the last 2 weeks of each month. I get my period every month now. Should continue at these levels indefinitely unless my symptoms change. I'm going to continue on my levels, which are pretty consistent now. Now that I'm really past menopause, like 20, 30 years. I stopped at 40 for sure. I went into premature menopause from the stress in my life. So 30 years now, and I'm on a stable hormone that I've been on, and I haven't changed it. and I have good levels all the time and a nice cycle. So yeah, and I'm going to tell my husband to put some in my coffin when I die. That's a joke. Asia says, "Hi, Dr. E. I had tooth surgery and have to take antibiotics, amoxicillin. What do you recommend to detox from this or take during surgery?" This is from February 4th, so it's already over with. But in general, probiotics I would take while you're on the amoxicillin and afterwards for the rest of the year to help rebuild up the lining of your gut and be very low carb. Uh, Dawn says, "Are ocular migraines related to inflamed vascular system or a precursor to stroke?" They don't have the answer to that. I mean, those of us who have migraines, and I have a history of migraines, and it would be associated with a visual alteration I could see right in the center of my visual field. And then it would gradually get bigger and bigger and bigger. It would be like little squiggly white lines. And it would start as a tiny little one, and then it'd get bigger and bigger and bigger and bigger and bigger until it was out of my visual field, one eye at a time. Usually it's associated with stress. Usually it's associated when I haven't been drinking enough of my water, or I'm traveling and can't control my diet, or if I forgot to take my enzymes. But no, it's not a precursor known for stroke. And we really don't have an answer for the phenomena of migraines and the scintillating scotomata that occur very often with the visual manifestations of migraines. And fortunately, I don't get the pain anymore that I used to get when I was a younger woman. So I don't think it says anything that your retinal health is compromised any more than you can fall down, scratch your knee, and it heals up. But you do want to try and live as clean as you can, take systemic enzymes, not eat late, drink enough, filtered water, and try and, get the, I use hydrogenated, or what we call the analemma wand. So I use this wand in my water, and I keep it in there, and I have my straw, and I'm always drinking structured water with my straw in it, like that. Because that will help keep me non-acidic, because cancers love acid, lack of blood flow, lack of oxygen. And if you drink enough water and you really do some exercise and move, you should have a long life. That's why I'm so happy to be invited to so many birthday parties now of my patients hitting 100 in their 90s and all these things. That's neat. Simone says, "Hi, Dr. E. Thank you for taking my question. My mom is 91 years old, 95 pounds. She has high blood pressure. The doctors prescribed her two medications, lisinopril 40 milligrams one a day in the morning, and carvedilol 3.125 milligram in the evening. She is still not feeling well with a pressure reading of 225 over 93. Your thoughts?" Those are high blood pressures. You should notify your doctor, and you need to manage with your doctor. If you brought her to a functional doctor, like we are here at Tustin Longevity Center, we'd be talking about, is she drinking enough water? Is the water filtered? Is she getting enough natural salt in her diet? Is she exercising? And is she even doing some bed exercises if she's bedridden? So there's so many things that can be done. We would look at her nutrient profile, see if she's magnesium deficient, vitamin C deficient, B vitamin deficient. All these things are a part of this tension, you might say. So many levels, it's too complex to address, but she needs to be seen. You need to report that blood pressure to the doctor who's prescribing for her. The lisinopril is an angiotensin converting enzyme inhibitor, and the carvedilol is a beta blocker. So she's on two different kinds of blood pressure blocking medications. and they certainly don't seem to be doing the job. And she's so small, I would say frail, that you have to have a doctor who is going to work with your doctors that are managing her blood pressure medicines and look functionally to ways in her lifestyle that you might find some help for her. And then there is a question from Asia. Hi, Dr. E. I'm curious what you know about the treatment called BioWave Crystal and if you recommend it. And she gives a link to that, BioWave crystals. Now, here's what I'll say. I love energy medicine. Everything's vibrating. And I did the second doctorate I did was in integrative medicine, and a lot of it was on vibrational medicine. There was a book written called Vibrational Medicine, and there was another book, The Body Electric. So we all are cells with electro potentials over the membrane. So everything matters. But this concept of BioWave crystal, what is his name? His name is, I can't think of but his last name is Vion, Vion, Stefan Vion. His website talks about this. He doesn't really have any YouTubes. He has testimonials, and I don't see any science being referred to from his website. So I'm not impressed. And I'm not going to recommend his website. He has these energy cells, you might say, and they're activated with, I think, red light therapy. There's so many levels of impact, the wavelength, the amount of the wavelength, energy, and timing it's exposed to, the temperature in the room, the temperature of yourself, how well you're hydrated, if you're having enough salt and good nutrients in your body. I mean, to just say a crystal is stimulated by a light wave, and the same goes for what's that name? LifeWave, LifeWave, the X39 patches. They're crystals. Yes, your body's infrared heats them up, and they do vibrate, and they do reflect back the infrared into your body in the patches, and they do communicate with your neural system. All of this is good to study, but as far as can we depend on it and treat on it and use it per se, it's still not ready for prime time. So I'm interested in following the science. I think LifeWave has more data and science than this thing called BioWave crystal. So if there's anything I was more impressed with LifeWave patches. And so it is now 7:03. I need to wrap this up. And so I'm going to have to leave. Great Insight Faithfulness, your daughter's question on our vision, and the grinding teeth question of Christina. Bring it up next week. I'll see you at 6 o'clock next Tuesday, which I think will be the let's see, 1, 2, 3, 4, the 4th of March at 6 o'clock. We'll do that here. May the Lord bless and keep us all. May we all love one another as we should, be kind to one another, and even love our enemies and do good to them that despitefully use you. And so God bless. Do the right thing. Take responsibility for your health as much as you can. And I will see you next week. Say, like, and subscribe. Okay, bye-bye.